All right, today I am here to talk to you about a pesky muscle for a lot of us called the iliacus or the psoas, or referred to as a group, the iliopsoas. We also call them your hip flexors. And if you have back pain, chances are good that that little group of muscles is involved in it. The characteristic for me that I see happen most for people who come in with these muscles causing them problems are that when they go to stand up, they get out of a chair and they get that sharp pain or pinch like right in the glute area, and sometimes in their groin. And it's just kind of classic. Or they'll bend over to pick something up off the ground, they can flex forward just fine. But the minute that they start to lift up, they just feel like their back is kind of unstable or gonna give out. So if that describes the kind of pain you have, listen up. The hip flexors are muscles. So here's my handy dandy spine. It's facing forward like that, okay? And the iliacus and the psoas muscles originate on the inside of these little processes on your spine. They pass through the pelvis and then they attach at your hip, okay? So they start on the inside of my low back, pass through my body, insert here at the hip and the groin, and when they contract, they flex your hip. They bring that knee up, okay? So if you spend a lot of time sitting in a chair, that muscle is in a shortened and contracted state. When it contracts and it gets shorter, it can lift the leg up or it can bend us over, which is exactly why when you go down to grab something, it's contracted. And when you go to lengthen up, it has to stretch. And if that muscle is tight or irritable or has a lot of knots in it, that straightening up, it doesn't do that so good, okay? So what we're gonna do is I'm gonna show you a great way to stretch your hip flexors. So grab a wall or a chair so that we're not focusing on balance here. We just wanna get a good stretch. So I have a chair that I already pulled up over here. Just see if you can see me well, and I think you can. Okay, so the key to getting this stretch done is that you want to line your feet up parallel to each other. Some of us, and here's another good indication that you need this stretch, is that you tend to stand bearing all your weight on one side and then you turn your foot out on the other side. That is an indication that that glute is slightly activated and that you potentially have a really tight hip flexor on that side. For me, I stand like this if I'm not paying attention, okay? So I'm gonna stretch my left one. See which one is tighter for you. Do it on both sides. I'm gonna stretch my left for the purpose of this video. Okay, so I've got my feet nice and parallel. They aren't toeing out, okay? And when I do that, I have my hips in a nice neutral position. And what we're gonna do is I'm gonna hang onto the chair here for balance. I could do it without balancing, but I don't want to focus on the wobble. We want to be nice and strong and stable so we can just really sink into that muscle, okay? So I'm going to take the leg that I'm stretching and I'm going to bring it back. I'm going to bring it back a good ways, okay? It's not like this because then you just don't really have any of that stretch. So get that leg nice and far back and have the front knee bent. You're lunging. My knee is not going past my foot, okay? I'm kind of at that 90-degree mark. And I can already feel a little stretch there. And as you'll notice, if I do a straight line from my head, it kind of goes to my foot. That muscle is not really getting challenged. It's just like I'm standing straight. So what we're gonna do is we're gonna take our shoulders and we're gonna pull them back. See, lost my balance a little bit. That's where the chair comes in really handy, okay? As I do that, I'm feeling a really good stretch. Things that I see happen for patients all the time is they get that foot back and their toe turns out. So then they're stretching the inside of their thigh. That pesky psoas is like, I don't want to stretch. This is not the path of least resistance. So I have to catch that toe and remind people to bring it back and point it forward, okay? The other workaround that the body will do because it wants to avoid stretching that muscle because it hurts is that it will start to open your hips to the side. So what I tell people, you're lining up on that railroad track, okay? You've got both feet pointing forward, using a chair or a wall for extra balance. You're taking your shoulders, you're bringing it back over the hips, you're opening that up. Then imagine that you have two headlights, like you're a car. going down the road, you want both of your headlights and your hips shining forward. So when you check in with yourself, if your headlights are pointing over there, it's not getting the right stretch, okay? So you gotta get your hips lining up forward, shoulders over. That's a good stretch. We're gonna take a deep breath in. Three breaths is my key, okay? Now, I've already managed to sink a little bit. If that doesn't feel like a good stretch, you can put your arms up and bend, okay? And as you do that, actually I want to bend this way. You're gonna bring your arms up and you're gonna bend away. Oh yeah, there. It's an even little deeper stretch, okay? So that is just a really good stretch to do if you have low back pain at all. If you do it, tell me how it worked.